At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live.
Hello and welcome to this pediatric and rare liver diseases episode of GLI Live. I am so excited. As you can see, I have extra special guests with me who we will get to right away. But hopefully you are enjoying all of the activities that GLI is offering with the larger pediatric and rare liver diseases community throughout this month of February. Again, I am wearing my stripes because we should be rare aware every day. And certainly as a patient who had a pediatric rare liver disease, I am very honored to be part of the celebration and recognition of this month. So today we have with us Dr. William Balistreri from Cincinnati's Children's Hospital, best in the nation, of course. He has too many titles and accolades for me to read and for us to be able to get through the rest of the episode. And equally august in very different ways, I have Samantha Mullaney, who is the author of Live Reel and an organ donation advocate, and clearly a fantastic mom of someone who knows very personally, who's a living embodiment of everything that we are about this month. So why don't I give you the opportunity to say hello, starting with the youngest member of our group.
It's your turn. Can you tell them your name?
Kendall.
Say it loud so they can hear you.
Kendall.
Kendall.
Kendall, it's wonderful to have you. Thank you for joining us.
Thank you.
We're going to make it fun. And you can stay for as long or as little as you want. Okay? And it's all right.
She says little.
Okay, fantastic. It's like being on a TV show, and then after this, you can watch yourself on YouTube and show your friends. How about that?
That's pretty cool.
Yeah. Okay, good. Samantha, welcome to the show.
Thank you.
Thank you.
Yes, I am Samantha Mullaney. I'm an author and a mother to two daughters. This is my youngest, Kendall. So
My
Fantastic.
sister's at school. She's in third grade.
she.
Oh, that's wonderful. I would be excited to go to school.
I went straight to kindergarten. I didn't go preschool.
You know, we patients are very special people. I can tell that you are the so smart and so persistent and so strong. No wonder you skipped right over that.
Can I finish my part now?
You can finish your part. Yeah, absolutely. Is there anything you'd want people to know about having a liver disease or having a transplant?
Liver transplant.
You have
Yay!
How old were
There
you
you go.
when you had your transplant?
9 months old.
9 months old. You got it out of the way early, and then now you just can go on and live your life.
And now I'm 6.
Now you're 6.
And you're doing awesome, huh?
Mm-hmm.
Yeah.
I can
Are you
tell.
proud?
Bye.
She's done. Thank you.
Well, I think there can be no better statement in favor of organ donation
Amen.
than that. To see that smile, to see that life, literally the gift of life. And so I usually start with doctors first, but I may start with patients first today, and just allow Samantha for you to, continue on and tell us about your story, Kendall's story, your family story, and how pediatric liver disease got you to this place.
Yeah, so Kendall was born in September of 2015, and as far as we knew, she was a healthy baby and just the sweetest little thing. And when she was 2 months old, I took her for a routine checkup. And I remember her pediatrician saying, "Does she look a little yellow to you?" And I'm like, I don't know. I'm staring at my baby all the time. Like, I don't know. And so they decided to run some tests. And in that moment, I kind of just felt like something's wrong. And so they sent us home and they said, we'll call you back with the lab results. And she called back and said, her labs are elevated, her bilirubin is elevated. And in my head, I remember it was a Friday, and in my head I thought, okay, I'll take her in on Monday. And she said, you need to go to the hospital right now. They're waiting for you. And she said, I'm sorry to say, but usually when we see these things, they're pretty serious. And so that was kind of the start of our journey. And so from then, Kendall had a surgery called GLI. She was almost 3 months when she had that. And we just thought she'll have that and she'll be cured. And unfortunately, that was not her story. The GLI didn't last very long. So at the time, our family was living in Spokane, Washington, and my husband was going to school. And at this time, they did not do liver transplants in Spokane. They did in Seattle. But both me and my husband were from Utah. And so we made the hard decision. My husband stayed in Spokane, Washington to finish school. He was in his last semester of law school. And me and my girls moved back to Utah, home to Utah, to prepare her for a liver transplant. So she had that at 9 months old. And then a year later, she needed a surgery called Rex bypass. That's rerouting the blood vessels. And then a year after that, she needed that surgery again. And in between all that, there were feeding tubes and therapy and too many hospital stays and doctor's appointments and all the things. But that's a little bit of her journey. And as you can see now, she's just a beautiful, sweet, darling little girl, and you would never guess what she's been through. I often joke that I should have gone home more from the hospital when she was so sick, because she doesn't remember any of it. And I'm totally kidding. I'm glad I was always with her, but she doesn't really remember much, and we're just so grateful she's doing well and thriving. So.
That is definitely the ultimate outcome. But Dr. Balistreri, most people don't even think that children can get liver disease. But your career is, belies that myth. And so please tell us about how prevalent pediatric liver disease is and the types of things that you encounter at Cincinnati Children's.
Right. Well, the story that Samantha and Kendall tell is exactly what motivated us to begin looking at these issues. When I was at CHOP, you mentioned your experience. We had 11 children in a row with biliary atresia that underwent the GLI. We weren't doing transplants, and they all died. And that was obviously some significant frustration to us. There's got to be a better way. And that became a focus when I moved here to Cincinnati. At the same time, we were curious about metabolic liver diseases, because that's always a fascinating experiment where one enzyme, one mutation can set the cascade of events that will lead to either death or significant liver injury. So that's been the motivation, and that's what we continue to focus on. And you're right, these diseases are way underestimated. Someone was asking just Monday about the incidence of one particular liver disease, and they said it's like 1 in 200,000. I said, well, then we must have all the patients in the world in our center, because it's clearly much more common than that. Biliary atresia, as Samantha and Kendall know very well, is our biggest issue. It's the number one indication for pediatric liver transplant. And unfortunately, even with all the warning signs that these children and parents talk about, the disease is underdiagnosed. It's late diagnosis. So we don't know the exact prevalence of any of these diseases, but I can guarantee you that there are many that are either misdiagnosed, undiagnosed, or late diagnosis.
That's one of the reasons that we are so proud to have the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics as part of our Pediatric and Rare Liver Diseases Council, because we feel that the more pregnant people and their doctors, the more pediatricians who know and just have it on top of mind to look for cholestatic diseases of pregnancy and the early signs, often well before perhaps a scheduled normal well baby visit, that liver disease might be a possibility. We feel we can increase the number of children who are diagnosed at earlier stages and at times when they have enough time and room to have as many procedures, as you were able to have for Kendall, and maybe forestall some in some cases. Is that, greater collaboration, Dr. Ballesteri, something that we feel is important to have?
Yeah, no question. It starts, as you mentioned, with the pregnancy or even prenatal planning to pre-pregnancy planning, because many of these diseases have a very early onset and are rapidly progressive. Certainly, biliary atresia.
Right.
The game changers have been newborn screening. Before the days of newborn screening, we would have children with these devastating metabolic diseases that were either not diagnosed or diagnosed too late for non-transplant options. And the same with biliary atresia, the awareness. We now understand that bilirubin levels, even in the first few days of life, can be predictive of the outcome. So much more needs to be done. And directly to your question, we have collaborated with the obstetricians to screen all women for hepatitis C. And then the mandate would be to screen the baby if the mother was positive. And that has led to the whole cascade of care being enhanced and improved, not only for the mother who may not have known she had hep C, but certainly for the baby.
Right.
So
hepatitis B is also often transmitted from mother to child, and it's reason that it's endemic in so many countries. And so I feel that there's an opportunity to have perhaps a little more comprehensive discussion about liver diseases rather than sort of advocating for, sort of one-off discussions. I know that in Taiwan, pediatric liver diseases are dealt with more of as a public health issue, and all the parents of newborns go home with a stool card so that they can play an active role, and not only looking at sort of jaundice, which you're right, if you may not be able to notice, but the changes in stool is also indicative, and giving that tool to parents to be able to know the signs and advocate on behalf of their child, I feel is something important, and perhaps something that we can scale as well.
No, there's no question. It's been adapted by other countries, Canada and so on. Hasn't really gotten off the ground here in the United States, but it's a very simple method. You're right, empowering the family, because so many times, as Samantha said, the mother will go in and say, my baby's still jaundiced. Well, all babies get jaundice. Don't worry about it. And in fact, many babies will be jaundiced, but it's a different type of jaundice. It's unconjugated hyperbilirubinemia. So it's clearly a matter of education, advocacy, and that's why I applaud what Samantha is doing about raising awareness, not only about organ donation, critical, but let's get downstream and really see exactly what we can do to recognize these diseases earlier.
So Samantha, tell us more about those efforts and your book.
Yeah. So my book has been a dream now for several years, and it just seemed like never a good time because, to be honest, with Kendall's journey, we really were in survival mode for years, and that's a long time. But finally, as she's thriving, I just felt so strongly that not only I wanted to provide some hope and inspiration for other parents that are just at the beginning of, a horrible diagnosis and just heartbreaking diagnosis. That's a better word. And there were so many lessons that our family learned along the way. And so my book is Kendall's story, but it's way more than that. It's lessons that our family learned through her journey and that anyone can take during hard times, whether they are familiar with liver disease or not. We all go through difficult times. And so that's what I want my book to be about, is just, inspiring others and providing hope for others through difficult times.
It's fantastic. We will put the link in the show notes for this so that people can find it. GLI will also be buying several copies to make sure that our council members can have it. And we want to support this in every way possible. It absolutely is, no matter what age of the liver patient, a very much a family experience and a family journey. And so I'm sure that many can benefit from these lessons. Dr. Balistreri, what lessons has COVID taught you about children with liver disease and children and their immune systems?
Well, that's a great question. It's taught us in 2 years, we're still learning, but it's taught us that children are resilient, are very capable of mounting an immune response. And certainly we were very worried about our immune suppressed transplant population or patients with autoimmune hepatitis. But they seem to tolerate it fairly well, with some unfortunately notable exceptions. The other issue is the willingness of the families to accept the vaccination for the whole family to protect everyone pre-transplant and post-transplant. And that has certainly been a major advance in our ability to fight against this pandemic.
I know how involved I've been, and GLI has been as a whole, in ensuring that transplant recipients were part of studies to assess the effectiveness of vaccines in us specifically, and really quickly using those data to be able to give recommendations and change policy to allow booster shots, or really the third a third shot regimen for us. And certainly, as I see, Samantha, you being able to send one child to school with having an immunosuppressed child at home, I feel like that sort of rapid research to policy pipeline has been effective in this case, and maybe we can do more of it to help people live fully but safely. One of the things that comes up very often in our conversations, we have many patients involved at GLI who started their patient journey as children and transitioned, thankfully, successfully into adulthood. But that transition from a medical care standpoint is sometimes a little rocky. So maybe I'll start with Dr. Balistreri and telling us how that works at Cincinnati's Children, since I know that you all have done a lot of thinking and operationalizing about that transition. And then Samantha, what would you most like to envision, because you're still a few years really from that, but you can help design the future. So Dr. Balistreri, what does that transition look like?
Well, it starts with communication, obviously, and but it's a difficult journey because you're so bonded to these families for so many years. Many of the children, like Kendall, that we transplant, we've known them since birth. So when they get to be 21, 22, or whenever people start twisting our arms to say, you need to move them to an adult center, that's very difficult. I think, especially if it's a distance away, and many of our patients come from quite a ways away, and there may not be a very close transplant center, as Samantha mentioned earlier. So that's a little difficult. But our team, our nurses, inpatient team have done a terrific job in working toward transition care with the psychologist and preparing these children for independence to some degree, compliance with their medication, tools for adherence, understanding their illness, and then communication. I can't emphasize that enough. The degree of communication between you and the center you're transmitting it to, or that you're working with if a patient is at a distance. So that's our plan. It certainly doesn't solve all the problems, but beginning very early, say when their child is 17, 18, to really begin that adherence and understanding.
My diagnosis was when I was 13, and I would say to start even earlier. I would say in middle school and certainly by high school, helping patients to find their voice. I've heard from so many other patient advocates, some of whom are still, receiving pediatric care, that of the importance that their parents having the doctor talk directly to them, and having them answer. Right. So that they recognize, they were the ones, in control, and building those systems so that they were responsible for taking their medication and recognizing even, because my diagnosis started with inflammatory bowel disease and progressed into primary sclerosing cholangitis. And so, what I ate might not have been what everybody else, could eat, and being the same as everybody else is so important when you're growing up. And so I think those issues, come upon you gradually, and then I would love for more adult care to be more like pediatric care, coordinated and collaborative and colorful even. I was like, where did all the color go in the hospital when you come off of the pediatric ward? Who says that adults don't like, a little color, in their rooms? And so I think we have a lot to learn from pediatric care, certainly in IBD and rare diseases, and having talked to the IBD groups at Cincinnati's Children and the parents there, they are really at the cutting edge of what we can do in terms of collaborative care. So one of the things I wanted to ask too, while I had you here, is in research. So I think we've identified some areas in policy and in operations where we could see advances, but in research for pediatric liver diseases, Dr. Balestrero, you've been involved for so long. What would you like to see, or what are you looking forward to?
Well, non-transplant options, number one, so that for those diseases that we really can't treat with medical therapies, obviously we need to understand these pathways. As I mentioned, my curiosity about metabolic pathways. And this applies to a group of diseases that we're very interested in, called a term called PFIC, progressive familial intrahepatic cholestasis. Terrible term, both in its length and in its meaning. And we really have been trying to figure out what really are in that group of diseases that cause cholestasis, with not biliary atresia extrahepatic, but intrahepatic cholestasis. So that's really been a major focus. And the goal would be that if we can understand those pathways and what the mutation and defect might be, we might be able to override that, as has been done for diseases like tyrosinemia. And so again, recruit more bright young individuals to the fight, and then have the support of people like yourself.
Thank you. And you shared a particular story of a bright young individual that I would love if you would share it for the audience, because it's so inspiring to me, and I'm sure inspires Samantha when she thinks about Kendall's future. Would you share that story, Dr. Balister?
Yeah, a simple story. We had a young 12-year-old young lady who had fulminant hepatic failure, needed a transplant within 3 days of admission. And throughout her recovery, difficult as with Kendall, she always said, when I grow up, I want to take your job. And she got herself into medical school, residency, fellowship. She is currently our transplant hepatology fellow, and indeed will take my job. Not right away, but she will. And it's inspiring to have her in the room with families because it changes the whole tenor of the conversation. As soon as she says, "Well, don't worry, I've been there. I've had a transplant," and then I might as well leave.
No, we still need you. We still need you. But it does. So often, as patients, you'll hear doctors say, "Oh, I know what you're going through," and you're like, "You do not know what I am going through."
Right.
And so, for someone who actually does, it creates so much trust and hope, and it really is wonderful. So. Give our regards to her and the continued success of her medical career, and it's definitely part of GLI's mission to help attract more young people to gastroenterology and hepatology, specifically, knowing how arduous but important a journey it is, as the number of patients who have liver disease just increases and are increasingly diagnosed and recognized. And so we need more.
No question. It's every day is a reward. It's just the reason I'm continuing to move ahead.
That's fantastic. So Samantha, what is your message? You work a lot in organ donation. What do you wish that people knew, or the public or families? And you have a return guest, and you came at just the right moment. What do you want people to know as we end the show?
I just want people to know just how important it is. How important it is that they can truly save, other people's lives. And I remember when we wrote our donor letter to Kendall's family, we unfortunately didn't hear back, but that was something that we felt strongly that we wanted to try to say thank you. It's really hard to put those words on paper, but I always thought, like, if something were to happen to her, like, I can't even imagine, but I'm like, okay, me and my husband, we can get through this. But when I think of Kendall's sister and how close they are, that is what always broke my heart if I would have had to give that news to my oldest daughter. And so just knowing the ripple effect of organ donation, and just, it's not just one person, but it's families, and those organs go to different people as well. And just the ripple effect of that is so huge. And I think to make that decision now, you don't know when it's going to be too late for you to make that decision. And I haven't been on the other side of it, so I can't imagine, but I do know what it's like to be on our side. And we will just forever be grateful for that family that saved Kendall. And just as a family, we think of them every single day, and we are just so, so grateful for them.
That is a wonderful message. It's also why we are fighting so hard for organ procurement organization, performance, so that every possible family, has someone who reaches out to them, so they understand what this opportunity could mean for them. Because I've been on unfortunately, my family has been on that side as well. and certainly what it means for all of the families and all of the lives that they would could possibly save and affect, for years and generations to come with that gift. So thank you for your advocacy, Samantha. Thank you for your parenthood. We'll let you get back to it. Dr. Balestreri, we'll let you get back to your patients and your research. And I thank you so much for your long career of stewardship with our hope and our dreams and our care.
Well, thank you for all of the work that you do, and let's keep the ball rolling.
Okay, that's what we do. All right, until the next episode.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well,